Hello everyone. Today we will discuss about the clinical aspects of the pancreas. Now first of all, the deficiency of the insulin actually causes the diabetes mellitus, because we all know insulin is actually released by the pancreas, right? Now also the pancreas is very important for digestion purpose, and deficiency of the pancreatic enzymes used in the digestion can cause digestive disturbances. Now pancreatic carcinoma. Now carcinoma is very common in the head of the pancreas, and pressure over the posteriorly placed bile duct, we discuss about this in our clinical aspect of the EHBA, that the head of the pancreas carcinoma can cause obstruction of the bile duct, okay, and can cause biliary obstruction, right? Okay, and this may lead to obstructive jaundice. Now also this head of the pancreas carcinoma of this may cause obstruction to the portal vein also, and this can cause ascites, or it may also cause obstruction to the stomach, okay, and can cause a pyloric obstruction. Now next is about the acute pancreatitis. Now what is pancreatitis? It is basically the inflammation of the pancreas. Now it may be a complication of the mumps. Now this pancreatitis basically result in the collection of fluid in the lesser sac known as the pseudocyst of the pancreas. Now we all know the in front of this pancreas there is lesser sac present, okay, and because of this pancreatitis, this basically cause the collection of the fluid in the lesser sac which is at the front of the pancreas, right? Now also the pain because of the pancreatitis. Now the pain is basically very poorly localized, and if there is pain in the because of the pancreatitis, it is referred to the epigastrium area. Pain is also referred to the posterior paravertebral region and also around the lower thoracic vertebral region because of the inflammation of the soft tissues of the retroperitoneum surface. Also, the pancreatitis may be primary or may be due to the gallstone in the common bile duct. Now, acute pancreatitis may cause gastric stasis and the vomiting. The autonomic supply to the midgut may be affected, resulting in the paralytic ileus, and because of this, whatever content is there in the stomach remains in the stomach only, because there is no movement, or there is we can say there is gastric stasis occur over here. Now one more important term is there known as the annular pancreas. Now what is annular pancreas? Now over here, as you can see, this is the second part of the duodenum. Okay, so what happens in the annular pancreas? This is basically a developmental anomaly or the congenital anomaly in which we know that the ventral and the dorsal buds of the pancreas during the developmental stage actually unites and forms the whole pancreas, right? But what happens over here is, as you can see, the head, the ventral bud and the dorsal bud of the pancreas actually encircles around the second part of the duodenum and encircles it, and actually forms such type of annular pancreas encircling the second part of the duodenum. Okay, and this can cause obstruction to the duodenum also. Now next is basically about the arteries over here. Now superior mesenteric artery, as you can see, this is superior mesenteric artery. Now superior mesenteric artery or the vessels are lying behind the body of the pancreas and in front of the uncinate process of the pancreas, right? Now the pancreatitis may cause inflammation, or the inflammation, we can say the aneurysm and the thrombosis of such artery and the veins. Also, since the pancreas has profuse blood supply, it is prone to hemorrhage. Blood can appear in the flanks or in the groin area, and it may also enter the bare area of the liver to run upward in the falciform ligament and reach around the umbilicus. Now finally, the pancreatic resection. Now what is pancreatic resection? It is basically removal of the pancreas or the part of the pancreas. Now it is very difficult and complicated procedure, and only remember the resection from the pancreas can be done only from its head or the neck is possible. So this was all about the applied aspect of the pancreas. So I hope you understood well. Thank you so much.